the home health care?
Yes.
For the Indian market.
Yeah, that's right.
To support the Indian market.
Well, first of all, we're making a financial investment to give them the capital they need to train and develop and expand services. But also we're giving them any operational support. We have 277 offices providing this service. We have an operating model which actually is fairly close to what's already happening. We're now going to be sending some senior people over for training. Dr. Dean and Frank Uller came to the United States to meet with us. We're opening up any of our materials. They have access to our internal portal and website. And anything we're trying to cooperate to provide any help we can. We're doing the research now. I've just hired someone or assigned the job to someone at Bayada to do all the research to advertise and find a connection to the United States NRI market so we can then generate referrals or contact families that need help in Chennai, Bangalore. So we hope to do a lot, we hope to do more, and we hope we're of some benefit. We really want to be of service and be in help in any way we can to make India home health care more capable and growing and take care of more people. Adam, do you have any?
I think that's perfect.
I think that's probably one other thing that I'd like to add that they bring to the table. I mean, Dr. Anita referred earlier to things like the stroke package. There's no such thing as a stroke package in India. So if somebody suffers a stroke, what do? They typically go to a hospital. They'll stay in a hospital until they come out. And I think that's something that first of its kind ever in India, where you have at home, at your place of comfort, where you are, especially the people who typically may suffer from stroke or a higher risk of stroke are slightly more mature people and aged people. So they get at their place of comfort, familiarity, they're getting support mechanisms that weren't there before, that help them recover faster, that help them perhaps get back their cognitive abilities, some of their familiarity in case there's memory loss. Those things are the first of its kind. I think the other thing that Mark and the team have brought, and that's why they're sending people to train. So the staff are about to go on training, is for children with special needs. So this is a huge part of, I think, the Bayada program. They have one of their major verticals around children with special needs. So, I mean, we run Mehta Children's Hospital. We see a lot of children with special needs in India. The question is, what do they do? So I think that's a huge opportunity that we're able to now serve people with trained staff, with clinical protocols that they have helped us develop and are customizing for India, and with trained people locally to kind of help those children with special needs be very productive and assimilate well into the market. So I think if you ask us what they're doing, I think, priceless things for India that you can't really put a value on, but these are things that we didn't have yesterday.
I mean, home health is a very nascent field in India. I mean, we were one of the first companies actually to operate in this, first organized providers to operate in this field. So, Bayada with 40 years of experience behind them, they bring a tremendous amount of knowledge and experience that we didn't have here.
Tell us a bit about your pricing of your packages.